Mold toxicity, one of the most devastating impacts on health, can lead to chronic nerve damage, fibromyalgia symptoms, chronic fatigue syndrome, muscle aches, joint pain, severe fatigue, inability to heal and repair, accelerated aging, and so much more. If you've been in mold, if you've been suffering from mold illness, and you're trying to make a comeback and a recovery, you don't want to miss today's show on how to detox from chronic mold exposure. Stay tuned, we'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone. Welcome to Dr. Osborne's Zone. Today we're going to be tackling a very difficult and challenging topic on mold detoxification. Now, before we dive into the specifics, I want to clear some definitions. This is a topic where a lot of people get confused. So let's lay out some definitions before we talk specifically about detox. If you look at this diagram, you can see here allergy versus colonization versus toxins. It's important to understand these differences when we're talking about detox. So we're going to lay these out for you so that you're not confused on the issue. So first, let's dive into mold allergy. Now, if you've ever had an allergy environmentally, like a ragweed allergy, dust, pollen, dander, that type of thing, this is what we're really talking about, an IgE allergy response. So if you've ever been to an allergist and had a skin prick test done or had a blood test done measuring IgE antibodies to different things, this is what we're referring to. Now, research shows that at least 22% of the general population is allergic to at least one type of mold. Common symptoms for allergy include itchiness, irritated eyes, coughing, sneezing, asthmatic breathing, and hives. We know that nutrients can be very helpful if you are exposed to mold in your general environment. And so some of those nutrients are helpful for the control of what's known as mast cell destabilization. Mast cells release histamine. So when we look at these symptom associations, it's as a result typically of histamine production, histamine release. Your white blood cells will release this chemical compound, and that's what's responsible for creating these symptoms. These types of white blood cells, oftentimes referred to as mast cells. So if you've heard of mast cell activation, a lot of people talk about mast cell activation in context with mold. What we're after here is either a reduction in histamine, so we want to lower it, or we want to stop it from being released in large amounts. And so there are a few things nutritionally that can be done in that regard. So for mast cell stabilization, nutrients that are probably the most helpful, the biggest one is probably quercetin. And if you combine that with vitamin C, it has a synergistic effect, stabilizing the membrane around these mast cells, reducing the quantity of histamine being released. Now, there are other things that can be added to this. We could put bromelain on this list. We could put nettle. We could also put NAC or N-acetylcysteine. These all work together synergistically to do that. So that's one strategy if you're just trying to support yourself nutritionally from the allergic response of mold if you're outside and it's a high moldy day, that kind of thing. And then we can also break down histamine, and there's a specialized enzyme called DAO, diamine oxidase, that helps to support histamine breakdown. Now, this enzyme, your body can produce it, but many of you, because you're in mold damages your ability to make this enzyme, and so you're at a loss, right? You're more reactive, having more allergy-type symptoms because mold toxicity has damaged your body's ability to adequately produce DAO. Now, you need things like zinc and vitamin B6 in there. So nutritionally, making sure you have adequate quantities of that nutrient pair, but also you want to get to the bottom of why your body's not breaking it down ultimately, which in many cases is mold exposure. So mold allergy is not the same thing as mold toxin exposure. They happen together, but they're two very different mechanisms. And so the allergy itself requires no detoxification. And I think this is where a lot of people get confused. If you're allergic to a mold, the way that you reduce your exposure or reduce your symptoms is you minimize your exposure to those molds. And so for a lot of people, this one, if you don't live in a moldy home or you don't have a moldy workplace or vehicle, then it's just going to be seasonal for the most part, just like many other allergies. So you don't need to detox from this, but you can take these nutrients as support agents to help your body deal with the consequence of an increase in histamine, which causes many of the allergy type symptoms. So again, no need to detox from mold allergy. Just supporting it is enough. So I think that's an important differentiation. Now, next we have something called mold colonization. Now there are a number of terms that we can use here. One of those terms, medical textbooks you'll find is a term called mycosis, which typically refers to mold infection. This is where mold starts to grow on the body or in the body. So infection, sometimes you'll also hear the word overgrowth. Mold overgrowth, mold infection, mycosis, or mold colonization. They all basically fall within the same family. And when you have mold growing on you or in you, there are different examples of this. So if you can see here, examples include a candida overgrowth in the gut, which is a very common consequence of people being exposed chronically to mold. And then more dangerously and more rare would be aspergillosis, which is where mold spores, where you breathe them in from the environment, they colonize in your lungs. This can kill you. This has a approximately 50 to 60% mortality rate when people get it. But these are just examples. There are lots of examples. I'll show you some more examples here in just a minute of mold growing on or in the body. Now, immunosuppression caused by chronic exposure to mycotoxins, which are the toxins that molds produce. The VOCs, also molds produce VOCs, volatile organic compounds. Hyphal fragments, which are like bits of mold pieces, and then dead mold cells. So these are all, if we classify or lump all these things together, this is really what we would clump together and call the toxins from mold, right? Mycotoxins, VOCs, hyphal fragments, and dead mold cells. Now, these things contribute to immunosuppression. Immunosuppression increases the risk of colonization. So when your immune system's not capable of behaving in a strong manner, it's not going to fight mold from colonizing on your body as effectively, and so you're at greater risk for this to happen. We also know, as an example here, mycotoxins specifically are antibiotics. Antibiotics, I mean, this is what penicillin is. If you've ever taken the antibiotic penicillin, it's a mold toxin. It's derived from the mold Penicillium. And so these antibiotic properties of mycotoxins will deplete the microbiome, which is your healthy flora in your GI tract. So in essence, it's acting like an antibiotic, and it's one of the biggest things that leads to candida and other types of yeast overgrowing in your gut, because we all have candida in our GI tracts. It's a normal inhabitant of the gut, but it's usually kept in check and kept balanced by healthy microflora or bacteria. But when you're exposed to tremendous amounts of mycotoxins that act as antibiotics on your microbiome, that becomes depleted, and so now the natural candida that's already in your gut starts growing out of control. And when that happens, candida starts generating its own toxins. So one of the toxins we know candida can produce is a mold toxin called gliotoxin. But candida can also do other things. It can also cause a mimicry of gluten. So if you're gluten sensitive, the hyphal wall fragments or proteins on the surface of candida can actually mimic gluten. We also know that candida can ferment your food. So it can turn your carbohydrates in your diet into alcohol, and that alcohol has, secondary consequences on the liver and on your nutritional status and on the integrity of the gut lining. So you don't want overgrowth of these yeast inside your GI tract, and this is a secondary consequence of mycotoxins poisoning your good bacteria, allowing this to grow out of control. So we know that immune depletion caused by chronic inflammation. So when you're in a moldy environment, you're basically, there's a term, many of you have heard this term called SEERS, chronic inflammatory response syndrome. That was coined by Dr. Richie Shoemaker years ago to describe biotoxin illness. Biotoxins are toxins produced by molds and other bacteria. But chronic inflammatory response, so your body becomes chronically inflamed, that weakens your immune system as well. And so it sets the stage, right? Your immune system's distracted. It's so busy attacking the toxins that it's being exposed to from the environment that it's not capable of defending itself efficiently against mold from colonizing the body. And so you get colonization. And so this typically occurs on the skin, in the sinus cavities, in the oral cavity, in the GI tract, as well as in the lungs. And sometimes the colonization is your own flora, meaning, as an example, candida. We all have some candida, but sometimes, it gets out of control, and now it becomes problematic. But sometimes the colonization is from the mold in the external environment. So the example there would be aspergillosis, the aspergillus molds in the environment. Now, these are some images or pictures of what mold colonization can look like. So we'll blow in on this. You can see this was actually somebody who came to see me as a young child, and they were in mold, and they had a severity of yeast growing in the oral cavity, as you can see here on the tongue itself. And you can see here even on the tip. So you've got mucus back here, and then you've got yeast growing actually on the tongue directly. This is another example of somebody I saw. This was a patient with rheumatoid arthritis, and part of what was driving their rheumatoid arthritis was mold exposure, environmental mold exposure. They lived in a moldy home, and what was happening to them is mold was also starting to colonize underneath the nail bed. So this is the hand, and this is the toes, obviously, but you can see the yellow discoloration and the white and the tips. This is mold colonization of somebody who's immunocompromised because they're in a moldy environment. Now, I've got some more pictures here. This was actually taken out of the journal Fungi, and some really good pictures of examples. And I just wanted to give you kind of a more diverse array of examples of what mold can look like on the skin. And these are different types. You can pause it here, but know that the types of mold infections are listed above in this description. And then each one of these images is labeled A through H, so that you can see the different varieties of mold that can grow on the skin and some of the examples of presentations of what they actually look like. So sometimes it's easy, right? You can see the mold growing, and sometimes it's not so easy. Like aspergillosis, if mold starts to grow in the lung, you're going to have shortness of breath. You might have some wheezing, or generalized breathing dysfunction. But sometimes it's a slow, chronic creep. It's not like an acute infection where you start running a fever and you need to go to the hospital right away. So sometimes the infection itself or the colonization is not super obvious, and I think it's important to understand that, because if you've been in mold for a long period of time and you're at home maybe watching this and thinking, how do I detox? I'm watching this show so I can learn how to detox. I think one of the areas where people fail detoxification is because they're colonized with mold, because they were immunosuppressed being in it. And so they try a detox protocol, or they get on a detox protocol, and it's not working. And it's because when you're colonized, when you have colonies of mold inside of you, one of the things they're going to do is they're going to produce mycotoxins. And if you're trying to detox these, you're not going to win, because you're maybe taking binders or doing other things to enhance your detoxification pathways. But here you have these colonies that are growing inside of you. So you have your own little mold toxin factory just spewing out toxins. And so the reason why many become unsuccessful is because they don't actually know that they're colonized with mold or yeast. And so they're just struggling to get better. So understand that colonization, if you have it and don't know it, this is something you want to work with a doctor to test for so that you can determine it and deal with it, right? Because if you're mold colonized, it will require detoxification, but detox happens after treatment of the colonization. So you have to, step one is you have to deal with the colonies that are growing on you or in you before you can begin detoxification. The next step in that would be detox. So you have to do it in the right order or you'll fail, become very frustrated, become very symptomatic. And that's why I'm parsing out these differences, because if you don't know this, you're going to be a miserable person trying to detox yourself. Okay, let's move into mold toxins. Now, we've said this before, but I'm going to kind of summarize it again. So mycotoxins, VOCs, hyphal and dead mold spores are all parts of mold or offshoots of mold that can drive a toxic effect in the body. They all drive chronic inflammatory reactions. One of the things we know about mycotoxins is they suppress DNA, RNA, and protein synthesis. We'll talk a little bit more about that in a minute. We know that they're fat soluble, and this is going to be important as you're thinking about your detox because they store in fatty tissues like the nervous system and your fat cells and muscles, the striatal, skeletal muscles, they do store in muscle fat. So it's important to understand that. They're metabolized by the liver, and we're going to go into the depth of that and what vitamins and minerals are important for detox through your liver. They're excreted from the body through sweat, urine, and stool. And part of that is with bile, so it comes out with bile. And it can become trapped in the body as well by bile, and we'll talk about that. And detox is definitely required. So when we think about, when people say, I want to do a mold detox, this is what we're really referring to. We're referring to detoxifying or removing and eliminating the mold toxins, VOCs, hyphal fragments, dead mold spores that accumulated in our body as a result of environmental mold exposure over time and that are driving chronic inflammation. We need to detox these things out of the body. Now, mold allergy, going back to mold allergy, we don't need to detox, we just need to remove ourselves from the environment and the immune system will calm down. And then mold colonization is where you're so immunocompromised that the mold starts growing on you and in you, and that mold growing on you and in you produces toxins that also have to be detoxed. So take all of this in context, very important so that you understand what you're doing when you're attempting a detox. But also so if you're working with the doctor, you can understand how to ask the right questions and how to have an engaging conversation so that you can win. Because at the end of the day, you're not in this for the fun of it, you're in this to get rid of it so that you can get your health back and restore your life. Let's look at mycotoxin exposure. I want to kind of draw a little bit of attention to this because if you understand what mycotoxin exposure causes, it's going to make more sense as you're going through your detox, especially if you're suffering from some of the symptoms of what we call detox response or Herxheimer response. But these are some of the main pathways how mycotoxins can damage the body. So over here we have mycotoxin disruption. Remember I said earlier that mold toxins act like antibiotics, and so they can wipe out good bacteria and flora. And unfortunately, that leads to a number of different problems. One of the problems it's going to contribute to is nutritional deficiencies. A lot of your vitamins are made by your healthy microbes that live in your gut, especially B vitamins. And so things like B vitamins, as well as a compound called butyrate. And why is that important? The B vitamins play a major role in detoxification. Butyrate preserves and protects the liver from the debris, from the toxin debris that can leak across your gut, because this is one of the other things that happens here. Mycotoxins cause leaky gut. And if you don't have adequate butyrate, you're basically, the contents of your gut leak into your bloodstream. But first, that part of the bloodstream is called the portal circulation. They go to the liver, and they put tremendous pressure on the liver. And so as they're damaging the liver, how do we detox? We have to detox through the liver, and we're going to talk about how that works in just a minute. But I want you to understand, this is why it's so hard, because when you're being exposed, your very detox systems are being damaged by the exposure. So even when you get out of the mold, sometimes your organs aren't up to speed, they're not up to par, they're barely keeping you afloat. And so sometimes you have to pace detoxification to your level of tolerance, because if you push too hard with organs that are, let's just say, under the weather, you're gonna feel terribly. So mycotoxins directly can cause leaky gut. They can cause leaky gut indirectly through microbiome disruption. Of course, leaky gut also leads to nutritional deficiencies, but it also causes, this is one of the hallmark problems of people that fail to recover once they get out of the mold, because leaky gut contributes to an increased food and chemical sensitivity. This is why so many people that are in mold develop multiple chemical sensitivities and multiple food reactions. And they get narrowed down to 1 or 2 or 3 foods that they can eat without feeling horribly. This is one of the mechanisms as to why. Now, mycotoxins can also cause an immune hypersensitivity, which is also something that contributes. So you got multiple ways we're getting to the same thing here, right? So this hypersensitivity puts your immune system on hyper alert. You've got foods that are leaking across the GI tract barrier. The immune system is overreacting, so it's looking at those foods and it's saying, how did these food proteins get here? We don't like them. We're angry. Let's attack that food. And so this is what hypersensitivity does. And so people become more and more reactive to foods and chemicals. I've had several patients over the years, they can't go out in public, they can't go to church because there may be some other parishioners wearing perfumes or colognes, and it just hammers them to such a great degree because of chemical sensitivities. I've seen cases too where people really struggle and they go on diets that are really restrictive, and one of the more common ones that you're seeing now come out of kind of popularism is the carnivore diet, and it's because many of these people that are going carnivore and feeling a lot better, they're in mold and they don't know it. But their solution to it was diet change of a sort. And so they've eliminated a lot of the foods that were causing reactivity, sensitivity, and allergy reactions. So they've reduced their inflammatory burden by restricting their diet tremendously to just meat. But this is a common consequence of chronic mycotoxin exposure. We also know mycotoxins can drive oxidative damage. The chemicals themselves damage your cells and your organelles within your cells, and that oxidative damage is a cause of chronic inflammation, which subsequently contributes to the development of autoimmunities, and autoimmunities ultimately lead to cancers. We know several mycotoxins are already classified by the International Agency for Research on Cancer as carcinogens. And so mycotoxins, oxidative damage, inflammation, autoimmunity, and cancer. We know that some mycotoxins disrupt hormones, and they do so through multiple mechanisms. And hormone disruption, because there's a lot of different hormones, but one of the types of mycotoxins called Zearelenone is an estrogen mimicking toxin. So it increases the activity of estrogen-like effects in the body. Hang on to that because we're going to talk more about it in just a minute. But we also know other hormones become disrupted. Hormones like cortisol and DHEA and thyroid hormone. We know that mycotoxins hit the pituitary gland in the brain and will disrupt the regulatory hormones that are largely in charge of your endocrine system. And so hormones like ACTH, adrenocorticotropic hormone, thyroid stimulating hormone, antidiuretic hormone, melanocyte stimulating hormone, follicle stimulating hormone, etc. So the damage to the pituitary gland, the neurological damage caused by mycotoxins can really disrupt your endocrine function. This is why many people in mold have just a complete endocrine nightmare of a health issue going on. We know that mold toxins also inhibit DNA, RNA, and protein synthesis. And what this does, so here we have all this oxidative damage causing all this inflammation to tissues, but we have inhibition of DNA and RNA and protein, and now we have all that inflammation can't heal. Because this ultimately what this leads to is the body's inability to heal efficiently, what we would call a repair deficit. So all of this can happen as a result of mycotoxin exposure when we're not healing as effectively. That also being caused by this over here, this nutritional deficiencies, can lead to slow or reduced healing. Nutritional deficiencies can also affect hormones. Nutritional deficiencies can affect our ability to do DNA, RNA, and protein synthesis. So you notice that we could draw a lot of arrows through here. There's so much interconnectivity between the damage that mycotoxins do and the body and the outcomes and the consequences. And this is why there's no one-size-fits-all approach in this regard. Now, I mentioned that I wanted to talk a little bit more about Zea. Zea is a mold toxin produced by Fusarium molds, and so what we'll see a lot of times is that a hyperestrogenic activity. So the estrogen mimicking mold toxin is what we're dealing with here. And this particular mold toxin for women can create estrogen dominance symptoms. So irregular heavy periods, worsening PMS, breast tenderness, fibrocystic lumps, and increased breast density. And this, oftentimes gets misdiagnosed as cancer or precancer. You go through all these mammograms and all that stress, when in fact, it could just be mold exposure creating these types of symptoms leading to that diagnosis. For men, we get erectile dysfunction. So guys, if you're struggling in that department, if you've got fatty breast tissue growing on your pectorals, this happened to me when I was in mold. I started to develop gynecomastia because one of my highest levels of mold toxins was in this category. And then we got muscle loss and weight gain, mood swings, anxiety, depression, irritability, persistent tiredness, low energy levels. These are all consequences of exposure to just this one. And I'm picking on this particular one, not for any reason other than I'm just trying to share more with you, but I also wanted to bring a couple of things up, because this is one of those mycotoxins that you can get exposure through the environment, but you can also get a lot of the exposure through food. And as you can see here, Zearelenone is an estrogenic mycotoxin, common food contaminant, and has been implicated in increasing the incidence of carcinogenesis, so increases cancer development and other reproductive health ailments through the estrogen receptor pathway. Now, I also sometimes wonder how many people in mold who have tendencies towards gender confusion are maybe being over inundated with this chemical estrogen. Nobody's done any great research on it yet, but I have to speculate with the quantity of people who really are struggling. You can see here, one of the things I want to point out is the use of flavonoids in the inhibition of the toxicity of this particular mycotoxin. The flavonoid that I have seen, this is just a little side pearl for you, is quercetin, because it blocks that pathway. It blocks that ERA, that estrogen receptor alpha pathway. So it has the potential to reduce the toxicity of estrogen dominance. in people that are dealing with this. Now, one of the other things we know about estrogen dominance, one of the reasons why women are more allergic than men, it has to do with estrogen. Estrogen increases the release of histamine from mast cells. It actually shifts the immune system in favor of that avenue. So, as I was mentioning earlier with mast cells, I said quercetin plus vitamin C to help stabilize those mast cells. Well, this is one of those intrinsic mechanisms, and so just shining a little light on that chemistry for you. One of the things I also want to point out is this was a study done in the US on maternal and placental microestrogen concentration. So how many babies and mamas' placentas had high levels of Zea or mycoestrogen. So they detected these estrogen compounds in 90%, 7% of urine samples of pregnant women and 84% of placentas. So very high quantities. And what they found is that consumption of ultra-processed foods, added sugars, and refined grains were linked to higher Zea concentrations, while healthier diets were associated with lower levels. So keep that in mind. Keep that in the back of your mind as we start talking about detoxification, because this is another area where people fail. When they try to detox, they're eating the wrong foods, and they're eating foods that have mycotoxins in them, and so they're less successful. Now, let's get into some of the elements of detox. Before you attempt mold detoxification, you have to do these two things first. So, bookmark this, highlight it, star it, whatever you need to do, but please don't attempt to detox unless you've done these two things first. Number one is you have to identify the source of the mold, and number two, you have to remediate that source. So if the source of mold is in your home, you've got to find where it's growing so that you can remove it properly, but you also have to find out why it's growing. So the two questions to answer: where and why? Because what a lot of people do, they see some mold growing, they spray some Clorox on it and scrub it off and say, oh, problem solved. It's not solved, I promise you. By the time you can see mold growing on substances, you've got it everywhere in your air. So you really have to understand where it's coming from or where it is beyond the obvious. Like in my home, just another example, we had no obvious visible signs of mold outwardly growing on our walls. Where our mold was predominantly was in the wall space. It was in the wall cavities. When we tapped the wall cavities, we had hundreds of thousands of mold spore counts, black mold, fusarium mold, Aspergillus penicillium molds in our wall cavities, and that wall cavity was just pushing air out into our living quarters, so we were being inundated by these invisible mycotoxins from mold growing in our walls. So you don't always see it, is my point. So identify the source of mold, where and why, and then remediate it. Remediate it basically means to remove it, but also to remove the source of why it grew. And the reason why mold grows typically is moisture. If you haven't yet watched my class crash course on mold symptoms and toxicity, I'm going to encourage you to go and watch that class. But remediate, part of remediation is identifying moisture. If you have elevated moisture above 55% humidity, then that's kind of a recipe for feeding mold, because your house is made of mold food. And all you got to do is add the water to the equation. It doesn't have to be running water. It doesn't have to be a roof leak. It doesn't have to be a pipe burst. It could just be high humidity or condensation occurring in areas where it shouldn't. Okay, back to mold detoxification. Common mold detox mistakes. I think I'm going to add one to the top of this list, is that detox is not a purge. It's not a one-size-fits-all, I'm going to purge my body real quick and then get on with living. Detox is a process. It's a process in your body that is always on. And you're not trying to fix your broken detox per se. You're trying to support your body's natural ability to do detoxification. And this is where I think a lot of people mess up, is they want to do everything passively. They want to take a pill or they want to get a treatment. But in reality, pills and treatments are passive. Detox is an active process. So keep that in mind. We'll talk more about, and I'll explain more and help you understand why it is that way. But common mold mistakes, aside from not understanding what detox is they failed to deal with the mold issues. Coming back over here. Number 2, the consumption of foods that feed molds or contain mold toxins. As I mentioned a moment ago, the ultra processed foods higher in mold toxins, alcohols high in mold toxins, sugary foods are high in mold toxins. Sugars and carbohydrates feed the mold that's colonizing the body, so consumption of the wrong foods. A third is that their bowels stay constipated. If you're constipated in mold, part of how you get rid of mold is through your bowels. How do you get rid of the toxins? And if you're constipated, they're not coming out of you. They're just being reabsorbed back through your bile to your liver. And then the last thing here is trying to do more than your body can handle. There's no such thing as one size fits all. This detox is unique. Every case is unique to the individual. It's unique to what they can tolerate. It's unique to their unique circumstance. So although I'm going to try to summarize a generalized process for you today, I want you to understand and take this one to heart, because if you push yourself too hard, you're going to be miserable and you're not going to make it. You're not going to be successful at detoxification. Okay, so an essential guide to mold detoxification. You need some things in your toolkit. These are what I call the essentials, the non-negotiable toolkit that you're going to need to tap into. And so number 1 is clean water. It's hard to get healthy if you don't have clean water and you're not staying hydrated. Water is how we detox. Water pushes things out of us. It pushes things out through the sweat, through the urine. And so think of it as the highway for exit strategy. And if you're dehydrated or you're drinking dirty water with other compounds and toxic chemicals, you're just going to bog your body down. So clean water's got to be priority for you as you're going through your detox. Sunshine. This probably is one of the most overlooked elements of a proper detoxification process. Sunshine exposure increases ATP production by your cells. ATP equals energy. This is what your body uses as financial currency. It'd be like you trying to navigate the world with no money. Your body, your cells have to navigate their world with ATP. And we get ATP production enhanced by sunshine exposure. It actually, the red light from sun accelerates the amount of energy our cells, our mitochondria are capable of producing. And understand that detox is energy rich. It sucks the energy from your mitochondria. It's a very energetic process. You need a lot of energy to do it. Sunshine is free. You just have to go outside and access it. Just like clean water generally is free. You may pay a water bill, but you may pay for your water filter, but these things are what we call low-cost non-negotiables, fundamental to detox. And then number 3 on the list is sleep. We don't heal if we don't sleep. And a big part of when we detox is when we're asleep. This is when we get the most work done in terms of detoxification. So go to bed on time. 9 p.m. Should be your goal. 9 to the next morning. But the kind of the window time frame, the ideal time frame to sleep, to be asleep, is 10 p.m. to 2 a.m. And not that I want you to just only sleep 4 hours, but these are the most critical 4 hours. And what a lot of people do is they're late night people. They stay up till midnight or 1 or 2 and think they can make it up by sleeping later. And the reality is you're gonna reduce your body's capacity to appropriately detox if you're not asleep in this window. So optimize this window. Ideally optimize even longer on both ends of that window, but sleep is non-negotiable here. Fresh whole foods. And we're gonna talk a little bit about diet. You've got a couple of things that are important to understand is that some foods contain mycotoxins And so if you're trying to push mycotoxins out of your body and you're eating a bunch of foods that have mycotoxins in them, you're going to struggle to get great success. If you're colonized, remember we were talking about mold colonization. If you are colonized and you eat the wrong foods, you're going to feed the mold colonizing your body, and you're going to drive up mycotoxin production from those molds. So it's important to understand you've got to change your diet. And a good starting place right here, if you don't already have a copy, is No Grain, No Pain. And I talk in the book about the right foods, what foods to avoid, what foods you can have. I talk about the mold and the mycotoxins in food, as well as the gluten and other things that are found in grains that are problematic. But the book is really a good blueprint for you to start under this category if you're not sure. Now, the other thing we want to do is movement to tolerance. Key is movement to tolerance. Why to tolerance? Because when you're so busy expending your energy on detoxification and healing and repairing from chronic inflammatory damage from years of exposure, you're not ready to go to the gym and just blast it out. So you move to tolerance. Many of you are struggling with fatigue and aches and pains, and so exercise is overwhelming. But you can start with something really light, like a small, short walk or some light stretching. But movement, remember, active movement of the body pumps that clean water through your bloodstream and through your lymphatic vessels, and it helps carry toxins to your liver where they can be metabolized. It helps carry those toxins to your kidneys where they can be excreted, and to your gut where they can be pooped out. So the movement becomes an important part of your recovery. Ideally, you want to sweat. Notice the trend here. These things here, all these things here are free. They don't really cost you any money beyond what you're currently already doing. And I think this is why I'm emphasizing this, because so many of you want the pill or the medical treatment, but these things are the fundamental. These are going to move the needle better than anything else that you do, and they're all free. You just have to understand it. So sweating regularly. Now, some of you will say, I don't sweat. And we'll just put a phrase at the end of that. I don't sweat yet. You know, being out in the sun, so you can kill two birds with the same stone with the sunshine and the sweat, especially if you live in a hot place like Texas or Arizona, where you have the ability to really get outside and let the heat happen. But this may be also something that you have to build up to. Just like the movement to tolerance, you might have to build up to the sweat. Usually what we see happen in people is, at first, if they're not sweating, we continue to expose them to heat to tolerance. And as they are more and more exposed to heat, get more and more movement, what starts to happen is they start beating sweat, and eventually they start trickling sweat, and then they start sweating. Regular bowel movements. This is the exit strategy for a lot of our mycotoxins, is through the bile, out the bowel. And if you're constipated or backed up, that's going to be problematic. Now, there are a number of strategies here that can help if you are backed up. My favorite strategy for irregular bowel movements is vitamin C. Higher doses. Vitamin C is an osmotic. It'll pull water into your bowel, and it will help you pass a movement. So if you're really backed up, consider vitamin C. For most people, that's anywhere from like 1 to 10 grams a day of vitamin C to hit the bowel and really allow for a movement. But as we'll talk about the depth of detox in a minute, you'll see where vitamin C is like it's like a multifactorial support nutrient. It can help you have bowel movements, but it can also help your liver process these toxins. Some of the basic diet change down here, talked a little bit about no grain, no pain already, but grains, coffee, peanuts, dried fruit, alcohol, and ultra-processed foods, as well as conventionally raised meats and dairy. What do I mean here, conventionally raised meats and dairy? These are the cows and the chickens that are fed all that grain that's contaminated with mycotoxins. If you're eating grass-fed, grass-finished beef, I'm not worried about heavy mycotoxin exposure. It's the conventional stuff, the conventional dairy. Look, in veterinarian medicine, the craziest thing in the world is that in veterinarian medicine, they have more strategies to deal with mold and mycotoxin exposure because they know this right here, this grain. There are studies showing that it's anywhere from like 30 to 70% of grain crops are contaminated with mycotoxins. And so what it does to the animals, and they've figured this out in farming, because when they lose their animals and the animals lose their fertility and get sick and die from mycotoxin poisoning, the farmers lose their money. So they take it super seriously, always follow the money. But they have done the science in veterinary medicine to know that when you have conventionally raised meat and dairy, the risk of mycotoxin contamination is through the roof. So what do? They put binders in their feed. They put special enzymes in the feed that breaks down mycotoxins. They use specialized probiotics that absorb and break down mycotoxins in the animal feed. They don't do that with humans. We're actually kind of, think about it, we're getting screwed out of some technology that works really, really well in veterinarian medicine, but they just don't apply it to humans. They should. A lot of our research about our understanding of mycotoxin creating damage comes from these vets. So I showed you this a moment ago, but just as a reiteration, consumption of ultra-processed foods, added sugars, and refined grains were linked to higher Zen concentrations, while healthier diets were associated with lower levels. So control that diet to control the mycotoxin level. If you're trying to detox and you're being retoxed, you're going to fail at your detox. And many people get frustrated there. And many doctors don't have this conversation. Even mold literate doctors I've had patients come to my office from other mold literate doctors where it's like, what do you mean they didn't change your diet? What do they mean they didn't talk to you that grains were a contaminated source of mycotoxins, or that you shouldn't drink wine because it's a source of mycotoxin exposure? But it happens, so now you're aware. Okay, I talked about this one already. Let's go over here to detox itself. So let's talk about phase one. There are two phases that we want to discuss to help you better understand this process. So phase one happens in the liver. And what it does is it converts these mycotoxins into intermediate compounds or metabolites via a system of enzymes called cytochrome P450. And so why is that important to understand? Many medications, so if you generally, when you're mold sick, you've been to many doctors, you've been put on what we call polypharmacy. You're on many medications to treat the symptoms that mold is causing, right? And these meds are processed, a lot of them, through the cytochrome P450 enzyme system. So what can happen is phase one detoxification can get bogged down. If you're on, let's say 3-4 plus medicines and you're bogging down this enzyme system, then these toxins aren't being broken down properly. So we've got to get these toxins out of the body, and to do that, we've got to get them through phase one. So if you're on multiple meds, just keep in mind, ask your doctor to do a med review with you, or your pharmacist, and just say, hey, which ones of these medicines are absolutely necessary, but are any of these medicines bogging down my cytochrome P450 system, which is going to hinder my body's ability to detox this stuff out of my body? Once you go through phase one, you take these mycotoxins and you break them down, and sometimes what they're broken down to is even more reactive and even more dangerous toxins. Now I know you're saying, well, then why would I want to free this up? I don't want more reactive, more dangerous byproducts. Well, it has to happen in steps, and this is step one. Step one is break these toxins down into a more neutral chemical that can then be water solubilized. Remember what we said before is that these toxins are fat soluble. So part of what is happening here is we're basically taking these chemicals from fat soluble to water soluble. Water soluble means that we can pee it out, we can poop it out, we can sweat it out. If it stays fat soluble, it gets stored in your tissues and it just hangs out and does perpetual damage. Now this phase one detoxification requires nutrients, requires vitamins and minerals, especially these ones here, these B vitamins, 2, 3, 6, and 12. So this is one of the reasons why we'll see people sometimes with heavy mold toxin burden do poorly with large doses of methylcobalamin, which is a type of vitamin B12. It's because if you're ramping up this part of detoxification with high doses, you're creating more reactive and more dangerous byproducts that then have to go through phase two detoxification. And if your phase 2 detoxification is bogged down or not working properly, then these things hang out longer and do more damage. And this is what can create some of the symptoms. It's already what can create some of the symptoms of what we call a detox response or a detox reaction. This process also requires magnesium, which half the country is deficient in, and it requires antioxidants like vitamin C and flavonoids. Quercetin, this one keeps coming up over and over again. I love quercetin. It's one of my favorite nutrients to use in people with mold because it blocks and helps with mold allergy. Quercetin is an antifungal, so it actually has antifungal properties that can colonize mold inside of a person. It also helps with phase 1 and with phase 2 detoxification. So it's kind of a catch-all in the category. So again, this is phase 1. Once we get through phase 1, we can go to phase 2. It also happens in the liver. And so what it does is it transforms phase 1 intermediates, so those other chemicals that we just processed, into water-soluble waste. So, and then that sets us up for elimination, right? Routes of elimination: bile, urine, stool, and sweat. And the key pathways and the nutrients required are listed here. If you want to pause it, take a screenshot of this, please do. And I'm going to try to not get too complicated here. There are 6 major ways. So think of it, what we're trying to do is we're trying to take these phase 1 chemicals and we're trying to attach a new molecule onto them that makes them water soluble. And there's different ways we go about doing that. One of those is called glutathione conjugation. It's where we attach a glutathione to a chemical to neutralize it and make it water soluble. And of course that requires glutathione. If you've ever heard people talk about glutathione as the master detox tool or the master antioxidant. But the liver uses tremendous amounts of glutathione every day to detox you from the environment in general, but it's necessary in order to conjugate some of these mycotoxins to get them out of you. We can use NAC as well. NAC helps to build glutathione. So N-acetylcysteine is a precursor directly to glutathione. So some people use NAC instead of glutathione. They both work really well. I like using them both personally. We know that just like magnesium was required for phase 1, we know it's also required for phase 2. We know that the B vitamins 2, vitamin B3, vitamin E, vitamin C, selenium, and lipoic acid. Well, what these last ones here, E, C, selenium, and lipoic acid, all recycle glutathione. So your glutathione is a lot like a battery. Once it's used up, it's drained. It has to be regenerated, so to speak, and these vitamins and minerals do that. So they basically replenish your glutathione stores. It's very, very important. So they're going to help you maintain healthy levels of glutathione throughout this. So that's glutathione conjugation. That's step one way, right? Another way is through a process called sulfation. And again, these are all part of phase 2. And sulfation is where we use vitamin B6 and molybdenum to detoxify. So molybdenum is a mineral. I just did a crash course on this a few months ago. If you haven't watched it, you might go back and check it out. And of course, B6 is a B vitamin, but both important and imperative for sulfation processes. Then we have methylation. Now, most of you have heard of methylation. Most of you are familiar with this one, and the reason why is it's kind of been made famous by my friend, Dr. Ben Lynch. If you don't know him, he wrote a book called Dirty Genes. It's a great book. If you haven't read it yet, it's a great one for you to get. But methylation, many of us have mutations or genetic SNPs that basically hinder our ability to methylate. And methylation is it's a fancy way of saying we're going to add carbon and 3 hydrogens to one of these intermediate phase 1 products in order to water solubilize it. So we're just adding a methyl group on those, and that requires B vitamins, B2, 6, 9, and 12. B9 is folate. And this is where many of you have a mutation, that MTHFR mutation, methyl tetrahydrofolate reductase mutation. If you have that mutation, then then this doesn't work as well, and so you need more B9 in order for methylation to occur. And so some of you, because of this mutation, your methylation is underperforming, and so your ability to detox is underperforming. And so by knowing that, this can be supported with these different nutrients. So these different B vitamins here, 2, 6, 9, and 12, as well as choline and SAMe, are very important nutrients as it relates to helping your body's ability to methylate properly. And then we have another process called glucuronidation. And so again, these are just 6 different ways we can take that toxin and make it water soluble. A glucuronidation requires magnesium, it requires omega-3 fat, and quercetin, and curcumin, resveratrol, milk thistle, grapeseed extract, and hawthorn are all excellent. Pomegranate too, you could put on this list. OPC is fantastic here. So these are all nutrients and food-based substances that can help you detox through glucuronidation. And then we have something called acetylation, which requires vitamin C, B1, B2, B5, magnesium, and lipoic acid. And then we have something called amino acid conjugation, which requires taurine, glycine, and glutamine. So you'll see this is a very nutrient-rich pathway, multiple different ways. The body is very redundant. It has a lot of different ways to get rid of toxins. You know, there's just these 6 different pathways, right? And all these different nutrients that are required to help those pathways work. This is why many people fail with their detoxification, is that years of mold-induced inflammation and damage has caused malnutrition. Let's go back to what I showed you earlier. We look at years of this. So just let this diagram sink in again now with the context of detoxification. You've got mycotoxin exposure, causes your healthy bacterial flora to diminish. That leads to nutritional deficiencies, but it also causes leaky gut. That leads to nutritional deficiencies. It causes hyperimmune sensitivities and inflammatory damage, and this draws nutrients, right? Because when you're chronically inflamed, you're burning through more vitamins and minerals to try to heal and repair the damage that's happening. It also, you know, they lead to inhibition of DNA, RNA, and protein synthesis, so it slows down the healing process. Of course, all this ties in together. So now that you understand a little bit about what mycotoxins do, plus detoxification, now you can understand why vitamins and minerals are so damn important and why doctors are so irresponsible in their approach in this if they're not measuring your nutritional status. It's the most important thing you can do if you want to customize your detoxification plan. Now, this isn't the first time you probably heard me say this, but I'm known for test, don't guess. Detox is unique to the person. I can give you a generic idea of what to do. That's all these supplements and foods that contain those nutrients that you can take in to support your body's ability to naturally detoxify. But if you are genetically disadvantaged, if you have an MTHFR mutation or an MRR mutation or an MTR mutation or a COMT mutation or an MAO mutation, any of these genetic SNPs that affect your ability to detoxify, if you have vitamin and mineral deficiencies and you're not even aware, it's going to affect and impact your ability potentially to detoxify. So let's talk about, this is where detoxification breaks down. This is where it doesn't work. This is where people get derailed. And the number one is here, nutritional deficiencies. Test, don't guess, test, don't guess, test, don't guess. Can't say it enough. Know what you need. Know what your body is asking for. Because it's not always the same, and we would assume for many, maybe it is glutathione. Well, when I see mold patients, oftentimes their glutathione levels are just fine. It isn't their glutathione at all. It's their glutathione recyclers. It's other nutrients that are impairing their detoxification process. So nutrient deficiencies can be measured, and they should be measured so that you are distinctly giving your body what it absolutely lacks to help it to detoxify. Another area where it breaks down is gut permeability. If you still have leaky gut, what happens is when the gut is leaking, the toxins from the stool, from the lumen of the gut, permeate through portal circulation, which goes where? Portal blood goes straight to your liver. And we already know that like this is one of the major causes of what's referred to as non-alcoholic fatty liver disease, because the different bacterial compounds, they're called lipopolysaccharides. So when you have a leaky gut, you have bacteria in your gut, right? And a lot of these bacteria produce LPS, lipopolysaccharides. These are also known as endotoxins. And everybody has them, but if you have a healthy gut lining, then you poop them out and it's not a big deal. But if you're broken, if you have permeability, these LPS endotoxins just go right to your liver, and we now know they cause fatty liver disease. And what were we just saying? That you need, in order to detoxify, you need phase 1 of liver, phase 1 and phase 2 of your liver to be functioning properly. But if you've got all these LPS toxins causing damage to your liver cells, your detox is going to suffer. You're not going to be as effective, and you're not going to get the job done as well. So permeability of the gut has to be kind of a pre-step to detoxification. It's one of the reasons why we check everyone's gut when they come to see me in my practice. We also know that when people have toxins that accumulate faster than the liver can handle, this is one of the reasons why, permeability. But the other big reason why toxins accumulate faster than the liver can handle is they haven't changed their diet. They keep eating them. Or they're still being exposed via the environment, through the air. And what I mean by that is they didn't get out of their house. They didn't leave the toxic environment in the first place. You're guaranteed to fail if you're not taking these things seriously and doing it in the right order. And when you get a toxic backlog, remember, mycotoxins are fat soluble. So one of the reasons we see the brain and the nervous tissue so strongly affected is because these toxins have an affinity for fat. And so they're going where there's a lot of fat, and that's your nervous system. They can also store in your fat cells. So I think another aspect of this where we could add to this would be that if you're overweight going into this, I know I was 25 pounds overweight when I was in mold. As you're regaining your health, you're losing weight healthfully. You're losing weight, but you're also in that fat, you're releasing toxins. And so sometimes what happens is you get an increase, Herxheimer, or an increased detox type of response. Actually, I have a name for this. I call it angry fat. Your fat is full of toxins. And as you're exercising again, moving again, not being poisoned aggressively anymore, and you're normalizing your body weight and breaking those fat cells down, that angriness that's coming out, and it's just doing damage on the way out. So it's important to keep that in context as well, because a lot of people get frustrated with their detox. But this is why you take it at your pace. You don't do more than what you can handle, but you should also know what to expect. Okay. Let's talk about common detox blockages. I mentioned leaky gut already, so I won't belabor that. Methylation dysfunction, I talked about MTHFR, but there are other genetic variants that can slow down somebody's capacity for detoxification. Glutathione depletion, as we mentioned, glutathione is the main tool the liver uses. Chronic inflammation, if you've got chronic inflammation of other causes. So remember I said earlier, that inflammation is an energy-rich process. Detox is an energy-rich process. And if your body is using its energy to heal and repair inflammation or to deal with detoxification, then healing is going to be kind of backburnered. Now, if you're doing other things that are causing chronic inflammation, and this is where we see this chronic inflammation piece persist, is in people that have colonization, as I mentioned earlier, and they don't know it. People that are eating the wrong foods. Oftentimes, too, we see people that are being exposed to other toxins, metals like heavy metals. And so what's happening is that chronic inflammation is just still being driven up. So these things are oftentimes best to deal with as well. And that's where, if you're working with somebody who's knowledgeable in all of this, you're gonna have a better outcome, in my opinion. I know that you should always take responsibility for your own health, and always at least try to feel better on your own before seeking out the help of a doctor. But if you've done that and you're not feeling better, you really, a lot of the mold cases I see, they're not do-it-yourself at home projects. They're really, you need to get professional help and guidance. And then the other one really is polypharmacy. This is a huge one. I mean, like I said earlier, most people that are going through mold detoxification, the average person that I see, they're on 3 to 5 or more meds, and those meds are being processed by the liver. It's basically they're bogging down the liver's capacity to actually be helpful at detoxification. But many drugs too, on the other side of just bogging down the liver, cause micronutrient deficiencies. They burn through your nutrients, or they cause you to lose or malabsorb nutrients. As an example, blood pressure medications disrupt magnesium. We saw magnesium a lot in those detoxification pathways. They also block B vitamins, and we saw the B vitamins playing a major role. Something as simple as Tylenol for pain can block your liver, or can bog your liver down and cause glutathione deficiency. So there are a lot of common medications that deplete nutrients that are going to really hinder detoxification. So if you're on multiple meds, it's time to work with your doctor and say, look, as I'm getting healthier, as I'm doing better, which ones can we start paring back? Are there things that we can reduce? Can we start reducing some of the doses? It's really, no medicine should be lifelong. It just shouldn't be the case. Your body works, medicines don't heal. I mean, minus the infections. There are a few exceptions to the rule. Generally, medicines biochemically block things. They're not working for you, they're working against you, but they're improving your symptoms so that we all kind of fall under the little white lie of allowing them to kind of stay part of our life because we feel better when we're on them, but they actually deter us from ever getting healthy. I mentioned earlier mold colonization, so just bringing that back up. Mold colonization, you want to rule that out if you're struggling through your detox. And then here are some natural things to combat mold colonization that if you do have it. So there's some things I'm going to show you. There's some things you can do at home, right? Beyond working with a mold literate doctor, which I think anyone going through mold should do, but I know that's not an option for everyone. So I want to give you some other options here. But one is the use of agents like caprylic acid and thyme and pau d'arco and olive leaf and oregano. These are all antifungals, so they have antifungal effects. They've been around for thousands of years. And so you can eat these, you can use them in your food. You can also take supplementation, and they all have an antifungal property. So when you're thinking about colonization, I want you to think about it in 4 ways. The way I like to think about it in my practice is I think about it in 4 kind of paths here. Let's shrink this up, and I'll draw those out for you. Number 1 is you want to flush it out. So this is especially true if you're colonized in your gut. If you're colonized in your gut, my favorite way to flush it out is a vitamin C flush. It's where you take 6 grams of vitamin C every 15 minutes in 3 ounces of water until you have diarrhea. That's a flush, right? You're getting a lot of that stuff out in one day. Now, if you're talking about like something in your sinus cavities, one of the things you could look at is like a neti pot. And you can drain out or flush out your sinuses. Some doctors actually prescribe neti pots or hook bottles and put, different essential oils in them that have antifungal effects. Some doctors prescribe nasal sprays that have antifungal effects. There are a number of different compounds that do. Grapefruit seed extract is a natural one, as is silver, but then you also have medications like amphotericin B and others that can be taken directly into the nose. So those are options if you're colonized. If it's on your skin, you can apply things directly to the skin, topicals. But these are just natural things that you can do to deal with that colonization. I've just given you some common examples here. Probiotics are probably one of the most important things to do based on the fact that we know mycotoxins disrupt your microflora, cause microflora deficiencies. And so probiotics support and help to balance back out your flora. And they also have antifungal properties. They compete with mold for resources. And so if you've got an overgrowth of mold or yeast in your body, you want to compete with it, right? So if we go back to our strategy, which is flush it out, strategy number 2 is compete with it. That's probiotics. Strategy number 3 is starve it. What does mold love? It ferments carbohydrates. It's the way it makes its energy. It's its primary way. So we look at low carbohydrate, low fermentation diets. In this way, we're minimizing the carbohydrate fuel source. This is another reason why people going carnivore feel so much better or can feel better, is that there's mold in their body and they're starving it out by not feeding it. So when you don't feed it, it doesn't replicate as well, it doesn't grow as well, and then your immune system can start to get ahead of it, which is what we're after. So you starve it out, and then number 4 is you poison it out, or you irritate it out. So these 4 strategies can be very, very helpful as you're navigating colonization. If you're struggling through detox and you find out you're colonized, flush it out, starve it out, create competition for it, and poison it out. And then again, if you're hitting a wall, find somebody who knows what they're doing, find a mold literate doctor, and work with them at this, because there are times where medicine is required or medicine is more beneficial than natural things. There are those cases, and so you want to keep that in mind. Now, I will say this, because we didn't really talk about it, but I think it's important. We'll talk about it in the binder section. We'll hold on to that. I think we're coming there anyway. Let's talk about, here we go. Mold detoxification. So ideally, you should get tested for nutritional deficiencies to target your unique needs. But these are things that can be done to support. So when you're trying to pull toxins out of your body, remember what we talked about. You've got phase 1, phase 2, and what some people call phase 3. These both happen. Phase 1 and 2 are both in the liver, require B vitamins, magnesium, glutathione, vitamin C, lipoic acid, and acetylcysteine, amino acids like taurine and glycine. Very important nutrients, right? And those are listed out here. You can screenshot this if you'd like. Phase 3 is gut and bile. It's where you're pushing that stuff out of the body in that place. And this is oftentimes where the conversation of binders comes up for detoxification. And there's a lot of different types of binders. Charcoal, my favorites are charcoal, fulvic acid, and zeolite. I'm partial to those because if you look at which binders pull which mycotoxins from the research that we have, these 3 cover all of your bases for the big mycotoxins we know are the most damaging. And so that's where I generally like to put people on binders. I'll start with those. But a lot of doctors are using what are called bile acid sequestrants, drugs like cholestyramine. And they can work, and I'm not opposed to somebody being on them. But I think there's precaution that needs to happen. And I'm going to precaution you because this is what I see in my practice. I get a lot of people that have come to me, they've been to doctors that have used, bile acid sequestrants like cholestyramine or Welchol for a very long time, sometimes longer than a year, but definitely many, many months. And these doctors didn't do this. They didn't test their nutritional deficiencies, and they're not supporting them nutritionally. They're just giving them, excuse my language, they're just giving them a bunch of binders. And the problem with these binders is they cause fat vitamin deficiencies. So the fat-soluble vitamins are vitamins A, D, E, and K, but also omega-3. So they cause these deficiencies. They cause fat malabsorption. They bind to fats in your bowel and push your fat out of you. So if you become vitamin E deficient, what did we say earlier about vitamin E? It regulates glutathione. It regenerates glutathione. This is important because here we're trying to do a detox, but the consequence of the detox is we're reducing our ability to regenerate the detoxification compounds. Vitamin A deficiency causes damage to the intestine. It can actually contribute to leaky gut. And you don't want that, obviously. Vitamin D regulates immune function. And when you're having hypersensitivity reactions and autoimmune reactions and you don't have enough vitamin D and you're taking a drug that drops your vitamin D even lower to the floor, it's going to pose a problem, and it's going to create extraneous symptoms that get mistaken for detox or get mistaken for something other than they're not. And then, of course, omega-3 is very critical because these patients are chronically inflamed. And if you look at chronic inflammation, right, SEERS is what they're calling mold illness. SEERS is chronic inflammatory response syndrome. Chronic inflammation. What resolves chronic inflammation? Omega-3. So the very thing that helps shut down your immune system's overactive responses and normalizes your inflammatory response is omega-3. And if you're on these at high doses, at the very least, just be aware that you need to be supplementing and you need to be monitoring your levels so that you don't get into trouble. So these are my note on binders. My favorites: charcoal, fulvic acid, zeolite. And then, of course, these other nutrients we talked about for phase 1 and phase 2 detoxification. The B vitamins, vitamin C, choline, glutathione, lipoic acid, NAC, probiotics, magnesium. I think probiotics deserve a special place in this conversation, that sometimes they are overlooked. But the veterinarian research is very clear on this, that probiotics do something called adsorb. They bind to mycotoxins and they help you poop them out. And so they should be a part of your strategy if you haven't considered them already. Especially different strains of lactobacillus and bifido, but also what's being studied is bacillus bacteria. Those are the spores, what's sometimes referred to as spore-based probiotics. And so there's another one that works really well called S. boulardii, and that's not a spore, but that's an actual type of yeast that competes with yeast, and it can bind mycotoxins as well, and it can also break them down. So there's research studies now showing that these different microorganisms can bind to mycotoxins. They can also degrade mycotoxins into less dangerous metabolites, but ultimately they help you get rid of them. Which is why probiotics can be such a benefit and such a help to support your path, your journey. Now, some people with mast cell problems don't do very well with a lot of heavy doses of lacto or bifido, so sometimes it's helpful for those individuals to be on more of a spore-based probiotic. We have one I use is called Biotic Force. If you don't tolerate, if you have like histamine-like reactions to the other probiotics, this is a spore-based that generally is extremely well tolerated and very helpful. So probiotics can in essence be a form of binder, and of course there's binders. Charcoal, fulvic acid, zeolite are my favorite, and then there's nutrients that just support detoxification, which we've talked about. And then down here there's healing support. One of the things that I think oftentimes gets overlooked here as well is omega-3. Specifically the subset of omega-3 called SPM, that stands for Specialized Pro-Resolving Mediators. I'll talk more about that in just a minute, so just hold that in your mind. And then protein consumption. A lot of people going through detoxification are not eating enough protein. When you're going through this process, if you can, it's important to eat a lot of protein. Ideally a gram of protein per pound of body weight, and that would be your lean body weight. If you're 100 pounds overweight, don't use that weight. You're taking your lean high school weight. So lean body mass, but a gram per pound. And so that a lot of you will be like, wow, that's a lot of meat. That's a lot of protein. Yeah, to heal requires a lot of protein. When you have chronic inflammation for years, your body's broken down. The mold toxins may have been the driving force, but they have torn your tissue up left from right, and you've got to put all that back together, and you're not going to do that without nutrition. You're not going to do that without adequate calories, specifically adequate protein calories. And remember, if you increase your calories in the carbohydrate family and you're driving up colonization issues, you can end up in trouble. So, and this is one of the cases where we really see lower carbohydrate diets being very, very beneficial for people, or what I call low fermentation diets, where you control specifically the higher glycemic types of carbohydrates, and the ones that are relatively guaranteed to feed yeast overgrowth and colonization. And then, of course, the other vitamins and minerals. This is an area that my expertise as a diplomate with the American Clinical Board of Nutrition is that vitamins and minerals, proteins, carbs, fats, nutritional compounds, hands down, they're the molecular workhorses of your body. They're what your body used to heal and repair itself. And the vast majority of doctors that I see dealing with chronic mold patients don't measure these things. They're not measuring vitamins and minerals. So get that stuff tested. I've mentioned that several times. If you've got a doctor you're working with, but they're not testing, and you want to get tested, but they are not testing you, use our test. Go to Gluten Free Society. I'll put a link up below. But use our INA test, intracellular nutrition analysis. It measures for 55 different nutrients, including all of your B vitamins, including your amino acids, including your omegas, and your minerals. So it's in things like choline and inositol, which help the liver and help it detox. So you can measure those things, and you can really get customized to what your needs are. Now I'm going to go back to what I said with the SPM a minute ago, because I just want to show you a diagram here. This is kind of a complex diagram. Don't get lost in the weeds on it, but I just want you to understand. Here we're talking about mold detoxification, and the primary illness that is involved with mold is chronic inflammation, CIRS, chronic inflammatory response syndrome. So think of this as the inflammation track is always on. So when we start with inflammation, you'll see the little start button and you see the injury. Well, that injury could just be mycotoxins creating the injury. Remember I told you earlier, mycotoxins cause oxidative damage, and that leads to injury or assault on your cells. And this doesn't have to be just in your blood vessels. It could be in any organ, any tissue of your body. We know that when mycotoxins are absorbed, and they're absorbed through the air, through your lungs, through your skin, and on your food, and as you eat them, once they are in your body, they get to go systemically. They are instantly systemically going through your whole body. And so they're going to do injury wherever they land. And what happens is you get these specialized white blood cells called neutrophils swarming into the area, releasing their chemicals to fight against the toxin. And ultimately, what that does is this pathway just stays on. It just stays on and it stays on. With inflammation, what's supposed to happen is you go through this phase in an effort to break down the damaged tissue, clear it out of the way, and then set the stage for healing. But when you have chronic inflammation and the damage doesn't quit happening, the injury is just happening over and over and over again, this is what chronic inflammation is. So you never get to resolution, right? Resolution is down here. You see, this is a initiation, transition, resolution, and homeostasis. Homeostasis would be health or normalcy, right? So inflammation starts at initiation, and as it goes through this process, it's supposed to be resolved. You can't resolve it while the toxins are still there, but how we resolve it, the way our bodies go about resolving it, is through something called SPMs, specialized pro-resolving mediators. These are fatty substances. You can eat them in your diet. They come from omega-3s. You can also take concentrated SPM supplementally. But this is what makes omega-3 so important, is that it resolves the inflammatory cascade so that you can be at a homeostatic state. And you see there's two places where they come in, and they work to get your immune system to quit attacking and blowing things up and to allow for healing and repair to occur. And so you've got to get to this point. This is where you feel good. This is health at the end. And so I was talking about those binders earlier and how those binders block omega-3. and block the nutrition involved in the resolution of healing. That's why if you do anything, walk away from this lecture today with anything in your head, it's you need to really consider your nutrition and your nutrient status as a fundamental element to resolution, to finalization of your illness and to recovery. If you're not, you're just going to keep struggling. I see it over and over and over again. People come to me all the time and they've already been through a detox. They've been through a treatment protocol. They've been through hyperbaric oxygen. They've been through all the passive therapies. And passive therapies can be helpful and adjunctive, but passive therapies are passive. You are the one that has to do the work. You've got to eat the right foods. You've got to take the right actions. You've got to sleep, exercise to tolerance. You've got to drink clean water. You've got to breathe clean air. You've got to get out of the mold. You've got to deal with the colonization, and all that requires work from you. And hopefully this presentation shows you a blueprint for that work that's involved in that process so that you have a formal understanding of what you're responsible for, so that as whether you're doing it on your own or working with another doctor, now you're educated and you can have those meaningful conversations and get better. I wish you all the best in this. I know mold toxicity is a bear. I've been through it. I lost a house to mold. I lost a dog to mold. And almost lost my wife to mold. I understand where you're at. If you're struggling, just don't struggle more than what you have to. Follow this blueprint and you'll get out on the other side. I hope this helps you. If you know somebody with mold, send this on to them. Thank you so much. We'll be back on Thursday for a live Q&A. Take care. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.